Hey, today I would like to introduce to you Miss Leslie Hargrove. She is a community health worker instructor, and she is here to share valuable information with all of you. All right, take it away, Miss Hargrove.
Hey guys, really glad to be here. Glad that y'all are here. I have been working, I'm with the Texas Area Health Education Center, or the AHEC, the coastal region, where I've worked for almost 30 years. I've been working with community health workers in one aspect or another for over 20 years. This is definitely a profession that I am very excited about, that I very much believe in and very passionate about. And so I want to appreciate the opportunity to talk to y'all. I am certified to do training for both community health workers and community health worker instructors, as well as serve as a community health worker in my own community. So I'm glad to be here and appreciate the offer. I'm going to flip the slide. Okay, we are talking about community health workers. You can see at the bottom has the formal definition of community health workers. But the big things that I want to point out in the definition is the things that make community health workers unique are that they are from the community that they serve. So that, they have the same challenges, the same resources, those types of things are very similar. And so they are better able to help. Okay. They also are trusted members of the community that they serve. And when I say community, that's a broad term. It could be a community, literally, as in a physical community. It could be a ethnic community. It could be an age group community. Think about it as if you were in a traditional high school or in a group of high school students and you needed information about a health topic. Who do you think you would trust and be more likely to listen to? Me, as a 50-year-old white woman, or someone who is in their young 20s or even in their late teens that has that information that comes in to talk to you about it? Okay. Just by instinct, we tend to trust those that look like us, that sound like us, because we think that they know better what we have. I mean, what we're going through and what information we need. That's the big piece that makes community health workers a very unique workforce, but a very effective workforce. Okay, you can go to the next slide. Okay. Job duties, you act as, or things, again, these are straight from the definition of a promotora or a community health worker, or it comes by lots of different titles. Here in Texas, they're typically either going to be a community health worker or CHW or a promotora de salud in the Latino community. Okay. Those are the same types of positions. Okay. You're going to act as that liaison between the community or a community member and the healthcare team. It may be between them, and a resources location that you're looking for resources. You help to advocate for them. You help to give them information. You may be doing health education with them. You may be sometimes doing informal counseling support. Advocacy is a big one for the needs of the communities that you're in. And because you see what the needs are. And so being able to advocate for that individual or that community is a big piece. So the job responsibilities are pretty varied. But again, that big piece is that you're that link, kind of that linchpin in between the community and what the community needs, helping them to get what they need. Okay, you can go ahead and. Three of the big things that you need to have for a community health worker is the knowledge of your community. These are the typical community health workers, or the people who know what's going on in their community. Okay, they're the ones that you go to if you need something. They're the ones that you that everybody and all of us know these people that everybody tends to go to when they need something or need information or need help. Okay, you really need to be able to communicate effectively. Being a community health worker involves a ton of communication skills, both predominantly verbally, but also in written. But verbal communication skills are key, because often that may be the issue between the provider or the agency and the individual or the community you're serving is a misunderstanding or not understanding clearly or being able to communicate what they truly need. And then being able to be empathetic or compassionate when working with individuals in the community. Being a community health worker for many is not a 9-to-5 job. It's who they are. So you find them often, they may help the person in the checkout line that mentioned that their car broke down and now they have no way to get to work. Their neighbor, there's kids at school, others, friends. It's a job that people tend to, it's who they are, it's who they identify as. And so it's not really a 9-to-5 job. And so having that empathy and having that compassion are important to be able to be happy in the job. Okay. This one was a hard one when they asked me what a day in the life looks like. Okay. A day in the life can look very, very different depending on where you're working. Many of the CHWs right now are being employed in healthcare. So that may be doing, I have CHWs on my payroll right now who are doing health education and promotion. They've done outreach related to the COVID vaccine, have gone door to door out into communities to educate people on the COVID vaccine, to help them navigate them to where they need to be to get a vaccine, to help them get the resources they need to do that. You may have one that's working on setting up a health fair that's coming up. So getting vendors, getting everything set up for the community that they serve. You may be teaching classes. We've had community health workers that taught diabetic education. There are community health workers, quite a few of them that are enrolled and signed up with healthcare plans. So not only do they help those in that healthcare plans possibly to sign up or to fill out paperwork, but also they do things like follow-up checkups on them. So if a patient was seen in the ER, they may send a CHW out to their house to check on them after that visit to see if they're doing okay and what may be needed and what, may be going on. So it's really depends on the day. For a lot of CHWs, it depends on who's funding your position. You may be funded to do one particular activity. And then really some of it even depends on you. Many of our community health workers, maybe an example would be they're funded to do diabetes education in the home. And then they go out to the home and to provide this diabetes education. But while they're there, they find out that there's no food in the home. Okay. So then that kind of shifts into a different sector of what they do in helping that person to access food and resources that they would need. So it can really just depend on kind of what's going on in your day to day and where you're working. This is a big change. Right now, community health workers can work anywhere. You could be working in, like I said, a lot of the paid community health workers right now are working in medical areas, either in provider offices, hospital settings, clinic settings, or with healthcare plans. But you could also be in the school. Some schools are using community health workers to follow up on children with attendance issues and with other issues, as well as the kids who may be in the communities and schools or other after school programs or programs within the school. You can work for nonprofits like the American Heart Association, the American Diabetes Association. All of those types of nonprofits have CHWs. You may be working for a community organization doing community activism and organizing around issues related to whatever's going on in that community, like violence or unsafe air quality or unsafe drinking water. Okay. And also community health workers are being utilized in research. This is another area that community health worker can have a niche into. So really there's not too many places that I couldn't make a good argument to have a community health worker because that they are just so effective in what they do. Okay. Go ahead and flip the slide. Okay. In the state of Texas, and Texas was the very first state in the United States that had a certification process for community health workers. And so within the state of Texas, community health workers, you have to be a resident of Texas. You have to be at least 16 years old. And you have to either attend a training program, 160-hour training program through a certified training site, or you can be they don't really call it grandfathered in anymore. You can be certified based on experience. But for most individuals your age, it's going to be the 160-hour course that will allow you to be certified. So what would happen is you would go enroll in a training course. And I was speaking with Evangeline and Ashley earlier, and that will be available. You will take the 160-hour course and you will complete that. Once the training site sends to the state that you've completed that course, successfully completed it, then there's an application that you would fill out that you turn into the state of Texas with your picture, a valid picture of yourself and information that they require. And then you would be issued a certified number. Every CHW in the state of Texas has a different number. Okay. And so at that point, you'd be given that number. And that's how you would be licensed. Okay. Every CHW, as well as instructors, are required to do continuing education. So not only do you have to, do the 160 hours, but every 2 years, you have to do an additional 20 hours of continuing education. And there's lots of different ways to obtain that. But you will be required to keep the certification. You do have to keep up on that and get the hours that you would need, which is a great opportunity for you to learn about different emerging issues like COVID or monkeypox or lots and lots of different topics that are out there that are available for continuing education. But you do have to have continuing education to be able to recertify, and we'll recertify every 2 years. Okay. I feel like I'm zooming through, but I do want to have plenty of time to answer questions and anything that you may need, because I think that's the important pieces. There are some really good resources for you. If you go to the Texas Department of State Health Services, their CHW certifications, it's online. You can find that online. It has a ton of information about the certification process. It has all of the applications that you would ever need. It has, you can look by geographic region for training sites. You can look for continuing education opportunities. You can link to other people. There is a board that operates under the Department of State Health Services that looks at community health workers. They are the board that certifies training sites. They certify instructors. They certify, they also help to make decisions about the certification process and the movement within the state and how that process works. But they're a good opportunity for the nuts and bolts of the process, I guess, and the logistics of being a community health worker. The Texas Association of Promotores and Community Health Workers is an association that is built and run by community health workers. This is a great place to find resources, to talk to others who are community health workers, to make those connections, and to build your network, which is extremely important. If you look to go into any social service field, building a network is incredibly important. And this is a good place for you to build that network within the state. They also hold conferences. We have a conference coming up next week, Monday and Tuesday in Waco. That's being held by the Texas Association. That will provide continuing education credits, but also lots of networking and collaborative opportunities. And so that's a really great opportunity there. There is a National Association of Community Health Workers. This is very recently developed, and they are working, another great resource, but also they do a lot of stuff around policy and around how we can forward the community health worker workforce. And it is a workforce. Community health workers are by the Department of Labor, they have a number, it's 21-1094. They actually have their own number as a job. And so it is a legitimate workforce. But looking how we can increase the workforce and increase the respect and the understanding of what the workforce is and how they should be supervised and function, and really pushing the big push this last probably 10 years is to look at true equity in employment. A lot, and historically CHWs in a lot of instances were expected to volunteer. And that's not really reasonable to ask them to do things at that level as a volunteer. Their time and their expertise should be paid for because they are a valuable resource to any project or any things. But those, you can also look and see on the Texas Department of State Health Services, it has a listing of all the local coalitions. If you're interested in this profession, find when the local coalitions meet. There's an association here in in Houston. There's a huge association in the Valley. There's one in up near Lubbock. There's one in Central Texas, McClellan County. There's a big one in the DFW area. There are community health worker associations that are local all over the state. And so that's another great place for you to kind of make some connections and gather that network around those or resources, and you can get those. Okay. Currently in the state of Texas, and this is not, I didn't pull up real time because it changes daily, but as of the last CHW report that was released at the end of this past year, 21, there were 4,208 certified CHWs in the state of Texas. Okay, so that's a lot of people. But when you look at the workforce, there's a huge amount of room for growth there. We need thousands more CHWs. There are 29 training programs that are certified in the state of Texas that are currently providing both the training for community health workers and community health worker instructors, as well as the continuing education component to it. which is an important component. And so there are 29 training programs currently. That number also fluctuates depending on the year. They drop off and add on. Average salary, as reported by the state, is $21 an hour in the state of Texas. Okay. Depending on what area you work in, as far as urban or, if it's a metropolitan area, CHWs in Houston make more money than CHWs in East Texas. That's just the reality of it. So depending on where exactly you work in the state will have a variation on that salary. Who you work for and what your job duties are will vary that salary. Okay. In my area, average salary is about $15 to $16 an hour. For a lot of CHWs, if you go into Houston, into some of the medical providers, it's getting 25 plus. Okay. There is opportunity for growth. I know several CHWs who come up through the ranks and have now become CHW supervisors and are making more than I do. So there is definitely growth potential there for those that are interested in that pathway. But again, this is really just, this has to be really a calling. It has to be something that you really want to do. You want to work with people. You want to help people in your community. You want to really help individuals get what they need. Has to be the calling there. If you don't have that, this is probably not the career for you, and you wouldn't last long in the career because it would become overwhelming. Okay. Go ahead and slide aside. When we ask for a quote, this is one of the ones that I, just as a person who's lived a long time, really think, don't count the days, make the days count. As young individuals, and I have teenagers that are counting the days till they graduate from high school, or counting the days till they graduate from college, and they can't wait, and they're trying to rush through life. Make every day count. Learn something new every day. Figure out what you truly enjoy and what you really want to do. Because once you get into the workforce, you'll be doing that every day, 5 days a week for years and years and years and years. And so you really want to find what makes you happy and what you get fulfillment from, so that in the future, those days go by happy and quickly, and you're happy at what you do. Okay. So make every day count. Don't try to rush to the next day. Really work to make those days count. Okay. I think we have okay. Question and answers. This is my favorite part. Okay.
Okay, yes. All right. Thank you so much. So before we move into this part, I do want to remind everyone that if you are enrolled in Career Prep 1 or Family Consumer Science course, you will be earning this certification this year as you go through your course. So this is your IBC for your course this year. If you are not enrolled in either of those classes, but you are interested, be sure to let us know on the survey. So on the question and answer survey, even if you don't have a question, you can leave that part blank, but just check the box that you want us to follow up with you on information on how you can earn this certification. Again, you do have to be 16, but if you're currently 15, but you'll be 16 by March is when we will submit them, then you can still go ahead and sign up and we can get you started. So for the questions and answers, I'm going to go through the form first and call out any student that left a question here. If you want to hop on the mic, raise your hand so you can come to the top of my screen here. But I have Alexis A. There you go. I'm going to ask you to unmute.
My question was, in the healthcare business, do the healthcare workers get a chance to help children with mental health problems? And do they get to help children and adults with social problems, like who have trouble speaking or maybe are just frightened or scared to speak? And do they get to help children in need of a family, like if they're going through a family problem with their maternal family, do they get to like put the children in like a foster care system and help them find a better family so they can cope with it?
I'll answer those questions in order and just let me know if I miss anything. But yes, you do get to work with children, depending on what area you're working in. But that is very much a possibility. Very often you play the role for children or even adults who may be have a language barrier or have a social barrier where they don't feel comfortable conveying what's going on or what's needed. And the community health workers, that's one of the big jobs they play, is listening to those that they work with and trying to help them get what they need, because they can't speak for themselves. They don't have a voice for themselves. With regards to kids who may be in unsafe or in position in families or in locations that are unsafe, that's something you'll go through within your training. But as a healthcare provider, there are certain things that you're required to report. And so that would be the biggest role, would be to do, you do have a legal obligation to report, but to also help in any way you can to make sure that that gets facilitated and to help with that. But a lot of that piece of it, you're the eyes and ears that may pick up on things that may go unnoticed by others. And so they do play an important role in that. But once it's turned over to CPS or to an agency, then they kind of take that role over. And that's more of a social worker type activity, who has special training in that. But you do get to work with individuals who may have mental health issues or needs, and you do get to work with kids. Yes. Did that answer everything?
Okay, so yes, she said yes. Thank you.
Okay.
Okay, so let's see, Ruth L. If you'd like to ask your question, and I will. Let's see, Javon. I thought saw Javon R. I'm looking on the form. That's how I'm calling the students. So Ruth asked, what are the working conditions and physical demands? What are the usual work hours, and how often do you travel? So I know that you mentioned that it's different for everyone. So maybe you can just speak to your personal experience.
It differs some. If you're working within a clinic, then it would be standard clinical hours, which are normally Monday through Friday, 8 to 5 type normal hours. If you're working as an educator, you may be required to do evening or weekend work, because a lot of health fairs and things that are and teaching opportunities are scheduled for times when people can come that are working a job. And so that may require some weekend or evening hours. So it really just depends on the job. Travel is, for most community health workers, travel is local travel. There may be travel involved, especially if you're doing home visits, but you're compensated for that. And it would be local travel. Any big travel, like state travel or travel to other states, would be for things like workshops or conferences. It wouldn't be on a regular basis.
Okay. All right, thank you. And Samantha, I'm going to ask you to unmute.
Hi, I have a quick question.
Yes, ma'am.
For the course, is it gonna be added to our schedule or is it like an out of school course type of thing?
Oh, okay. So when you were messaging me about, it's separate from what Ms. Hargrove was mentioning. So the
Mhm.
course that you will be enrolled in will be, it won't be a part of like your Class Connect or your course schedule. You'll be added to a room. If you're not enrolled in one of the courses, Career Prep or FCS, but you're interested, then you will be added to a separate like support room that you will see in your online school.
Okay, I was just wondering.
Yeah, so just be sure to let me know on that survey. You
All
can
right,
just check
I'm
that
gonna
question.
be filling it out shortly. Thank you.
Yes, thank you so much.
And I will say that a lot of the things that are taught in the community health worker course, the communication, the professionalism, organization, all of those things will help you in any job that you go into, in any career that you go into. The skill set is extremely helpful for anything that you go into.
Thank you for adding that. All right, so we'll take our last question. Josie, I'm going to ask you to unmute.
Okay, I got a question here. So say if we're already taking family consumer science, so do we still have to fill out the form or no?
No, because your teacher's going to already set you up with the instruction to earn the certification.
Thank you, ma'am.
You're welcome. All right, so that was a quick one. I guess I'll call here on, oh, let's see. He's asking in chat. Okay, let's see. I have a couple other questions here on the form, but I think you have covered them. The last one that just came through, would this help me become a nurse? So if you want to speak to that, and then we'll wrap up after that.
Okay. None of the skills that you'll learn in this would be bad for you becoming a nurse. It's not going to go towards your nurses as far as training wise for the nurse, but it is a good background, especially in you would use a lot of the skills that you'll gain in the community health worker course in your nursing career. But as far as if this dovetails directly into nurse training to become a nurse, it does not. But if you have questions about becoming a nurse, I can definitely answer all of those too, because that's what AHEC does. And so if you have questions about that and the differences between nursing and those kinds of things, please feel free to reach out to me, because I'd be glad to go through that with you.
Well, thank you so much, Ms. Hargrove. We truly appreciate you volunteering your time to come and give us all of this wonderful information about this opportunity for our students. We definitely would like to invite you back in the spring, maybe to help mentor and help guide some students that may need it, give them that push and encouragement that they need to get that certification. So again, thank you so much for your time. And on behalf of Texas SCP, everyone that joined today, I hope you found it beneficial as well. And we'll be having some more chats coming up in the coming weeks. So we hope to see you guys there. Bye, guys. Thank you so much.
And
Thank you. You
Bye.
too.
You too.
Bye, everyone.
bye, guys.